So in this podcast, I'm going to be talking about malaria. And without a doubt, it's been the biggest killer of humans in infectious disease history. But we've developed, great ways to combat the disease with both prevention and curative measures. So my question is, why do we still have such a significant burden of malaria with 300 million cases a year and over 500,000 deaths? It's no wonder that it is still such a top global health agenda. So I'm going to basically take us through a pyramid of factors that I believe are contributing to the malarial burden. And basically then just touch on what next can be done. So the first challenge I'm going to take us through is the scientific challenge. If we think about the life cycle of malaria, it's a really resilient organism because it has to live both in the host of the cold-blooded mosquito and the warm-blooded human. So it needs to develop ways to combat both of these immune systems. So that in itself kind of represents the complexity of this organism. Having said that, we have had a cure since the 1600s. The missionaries in Peru, they found quinine in the bark of the cinchona tree, which still stands as the most effective treatment of malaria worldwide for the falciparum form, which is the most common. So with this in mind, there must be other factors in play contributing to the burden. So this brings us on to who and which communities are being affected, and it is the rural poor communities. So this brings us on to the next challenge I want to talk about, which is the demographics of the disease. Why do these communities still have malaria? Well, if we think about it, they're in poverty, so they don't have any infrastructure. They have poor housing and poor drainage, which is perfect for the malaria mosquito to thrive on these damp conditions. And it's this kind of poorly drained habitat which is creating this perpetual cycle which is hard to break. So if we think about it, poverty, it's driving malaria. But this in turn is actually driving poverty, because often there's malarial surge kind of seasonally when farmers need to harvest their crops, so they're not well enough to do so they're not selling, so they're not getting money, and this again is just fueling poverty. So what really needs to happen is for this to be prevented, and this includes tackling both poverty and malaria together. So this leads us on to the third challenge, which is an economic challenge. Even if you do have a vaccine for malaria, how do we intend to deliver these vaccines to these remote places where there are no infrastructure or no roads to get there, where there's no electricity to store the vaccines in these refrigerators? There's no healthcare systems in place to set up, a weekly malarial service. So it is difficult, but this challenge isn't a novel one. It's been around for centuries. If anything, I want to move us on to a challenge which is often not talked about, and one which I'm beginning to kind of comprehend, which is the cultural challenge of malaria. So paradoxically, from actually going to these communities and speaking to them or visiting them in malaria endemic areas, you realise that where malaria is most prevalent, it's actually cared about least. Because to them it isn't, a killer disease which is as frightening as something like Ebola. It's actually a day-to-day kind of encounter, which how maybe the Western world sees cold or flus, they see malaria. So take, for instance, a child in Tanzania. They might come into contact with malaria, say 12 times during their childhood, and they'll kind of develop this acquired immunity to it, meaning that when they get it again, they're less likely to die from it. So again, it fuels their perception that it isn't as scary or as fatal as we might see it in the Western world. So the question is, how do we get these communities to kind of take the preventative measures and to seek medical kind of advice about diagnosis and treatment when they do actually have malaria? Well, let's recap. We've got multiple challenges that are all kind of working together to contribute to this burden. but they're all essentially governed by one thing, which is a running theme in global health, and that is politics. So how do you get a political leader kind of on board to fight a disease that has been existing within their communities for centuries? Well, historically you don't, and that's why a lot of the drive to combat malaria has been from external governing bodies, Western NGOs and areas of the World Health Organization. So let's go back to the first campaign, which was the 1950s DDT campaign. They wanted this to eradicate malaria, and it was a cheap, easy tool that didn't have any scientific basis as such, so that they could go to the areas where malaria was and successfully get rid of it. And this did work in kind of the temperate areas, so we've eradicated it in most parts of the globe. But they had good healthcare systems and infrastructure, so lo and behold, the issues we have today are in the remote rural communities where they didn't have the infrastructure or the healthcare systems. So this campaign essentially failed the poor kind of communities of the world, and they're still living with this burden today. So then, going to the most recent campaign, they wanted another cheap and easy tool to use. So they came up with the mosquito net. They distributed it to the poor communities in the hope that by them using a simple preventative measure like this, it would dramatically reduce the kind of burden of malaria. However, as I was saying about earlier, there obviously is this cultural perception that it isn't a killer disease. So for communities to use a malaria net at night when it's hot and stuffy, it's going to stop the breeze coming in. It's often an inconvenience to put up in a small hut that might be circular and the actual net's square. So in reality, and they did a follow-up kind of research on this, only 20% of the first distribution of nets were actually used. And so again, there's another flaw in this simple, cheap way of combating malaria. And the only way that they've shown a kind of improvement in this tool is by actually using education and time and money and effort to basically, educate these communities. So that is completely going against the cheap and easy tool, because it's actually now a time-consuming, resource-heavy intervention. So what next? How do we actually practically go about tackling all of these factors that are contributing to the burden? Well as education for the communities to use these preventative measures, and as well as continuing with our scientific research for a possible vaccine, we need to think about a different approach, which is not just tackling the disease from the outside and a Westerner's perspective, but actually thinking about tackling the malaria way of life, which is poverty breeding malaria and malaria breeding poverty. So we need to build malaria out, essentially. And that means improving infrastructure, improving the houses and sanitation, so we create an environment that is actually not advantageous for the malaria mosquito. So in summary of this podcast, I've taken us through who is still affected by malaria, why they're still affected by malaria, what's being done so far to combat the disease, and what is next for the future.